Welcome to the Depth Dive. Today, we're getting into something really practical. We're looking at a resource from Blood Test UK. It's their local guide for Southport, focusing on, understanding the thyroid blood test.
Right. And it sounds complicated, maybe, but let's break it down super simple. Think of it like this. It's a checkup for your body's energy control center.
Energy control.
Yeah. It measures key hormones, T4 and T3, which the thyroid gland makes, and TSH, which is like the boss signal from the brain.
Okay.
So TSH basically tells the thyroid, the factory, how much work to do. These hormones, they control how fast everything runs your metabolism, how much energy you have, even how fast your heart beats. They're the regulators.
Got it. So why would you specifically need this test then? What are the clues?
Well, the big ones are things like feeling tired all the time, like really dragging, or maybe weight changes, gaining or losing that you just can't explain. And sometimes a doctor might notice your heart's beating a bit too fast or irregularly. Those are signs your body's kind of shouting that something's off balance.
Right, the system's waving a flag.
Exactly. And what's really interesting from the Blood Test UK guide is the emphasis on catching things early.
Early detection, yeah.
Precisely. They mention experts, like a Dr. Smith, who stress that routine testing, just checking these levels regularly, can find problems like, say, hypothyroidism, that's an underactive thyroid, before the symptoms get really bad.
So you catch it when the factory's just slacking off a bit, not totally shut down?
You got it. High TSH usually means the brain's yelling louder because the thyroid isn't listening properly.
And this actually makes a difference. The guide had an example, didn't it, from Southport?
It did, yeah. A Mrs. Jones. The guide mentions her routine test, picked up the issue early. She got treatment quickly, and apparently it, quote, transformed her energy levels and overall quality of life.
Wow. Transformed. That's a strong word.
It is. It shows that getting onto it early really helps with things like mood, keeping it stable, and just having that consistent energy day to day.
So it's not just about feeling less tired. It's about, overall quality of life.
Absolutely. And looking bigger picture, which the guide touches on too, regular checks help prevent much more serious stuff down the line.
Like what?
Well, untreated thyroid issues aren't just about energy. They're linked to things like heart problems, serious ones, and even bone issues like osteoporosis. Consistent testing helps avoid those long-term complications.
Okay, that really brings it home. And the guide, being focused on Southport, talk about where you can actually get this done locally, right?
Yeah, that was a key bit of local info. It's not just hospitals. The Blood Test UK site makes it clear you can go to local private clinics, and even some pharmacies in the Southport area offer these tests.
So pretty accessible then.
Seems like it.
Yeah.
The focus feels like it's on making it easy and quick to get tested, minimizing those delays.
Makes sense. And how do you get ready? Anything special you need to do?
It's usually quite straightforward. Normally no need to fast or anything like that. Staying hydrated though, drinking enough water, that always helps make the blood draw easier. But here's the really critical bit they highlight. You absolutely have to tell your doctor or the clinic about all the medicines you're taking, even supplements.
Oh, really? Why is that?
Because some common medications can actually mess with that TSH signal we talked about. They can change the levels, potentially skewing the results.
So you could get a wrong diagnosis if you don't mention everything.
Potentially, yes. Accuracy really depends on them having the full picture. It's super important.
Right. Good to know. So you get the test, you get the results. What do they actually tell you?
Basically, they show if your thyroid is underworking, that's hypothyroidism, or if it's working overtime, which is hyperthyroidism. Knowing that helps your doctor figure out the next steps.
And those steps can be simple things. The guide mentioned lifestyle changes.
Yeah, sometimes it involves medication, but the guide also points to things like simple dietary adjustments, like making sure you get enough iodine, which the thyroid needs, and interestingly, managing stress.
Stress. How does stress tie into thyroid function alongside something like iodine? That seems like a different category.
It does, but it's a really important link. Your thyroid is actually very sensitive to stress in your body. Chronic stress affects the pituitary gland in your brain.
The gland that sends out the TSH signal. The manager.
Exactly. So if you're constantly stressed, that manager, the TSH signal, can get thrown off, sending confused messages to the thyroid factory. So while iodine is the raw material the factory needs, managing stress helps make sure the manager is giving clear, steady instructions. Both are vital for keeping that energy balance right.
That makes a lot of sense. So ultimately, the guide's takeaway is that keeping an eye on this with regular tests is just, well, good for your overall well-being.
Pretty much. It keeps that core energy system humming along, and crucially gives you peace of mind that you're potentially avoiding those bigger health issues, like for your heart and bones down the road.
Okay. So, based on everything we've pulled from the Blood Test UK guide today, here's something to think about. What's the one big stressor you could maybe try to manage better right now? Consider that, because your energy levels, your thyroid health, might just be linked directly to it. Don't wait until you're exhausted. You can find more details, especially those local Southport insights and testing options, on the Blood Test UK website.